In this lecture, we'll be discussing the drugs used for glaucoma. Now, the code is glaucoma. B stands for beta-adrenergic blockers. Now, topical non-selective beta blockers like timolol, betaxolol, and cartiolol are used in the treatment of glaucoma. Now, the actions: they decrease the aqueous humor formation by blocking the beta 2 receptors on the ciliary epithelium. The second action is beta blockers also decrease the ocular blood flow. Now, timolol, it is widely used in glaucoma because number one, it does not affect the pupil size or accommodation. Number two, it lacks on anesthetic properties. Number three, it has a longer duration of action. Number four, it is well tolerated. Number five, it is less expensive. And number six, it is safer and highly effective. So the first drug is beta-adrenergic blockers, mainly timolol. Other drugs are betaxolol and cartiolol. Now, L stands for latanoprost, which is a prostaglandin analog. Now, topical prostaglandins such as latanoprost, travoprost, and bimatoprost, they are the drugs of choice in open-angle glaucoma because of their longer duration of action, high efficacy, and low incidence of systemic toxicity. Now, latanoprost, it is also available in combination with timolol. Now, that is L. Coming to O, osmotic agents. Now, the osmotic agents used in glaucoma are mannitol, 20% IV infusion, and 50% glycerol via oral route. Now, the osmotic agents, they draw fluid from the eye into the circulation by osmotic effect and reduces the intraocular pressure in acute congestive glaucoma. Now, the fourth drug is carbonic anhydrase inhibitors. Now, carbonic anhydrase inhibitors include acetazolamide, which is given via IV and oral route, dorzolamide, which can be given topically, and brinzolamide, which can also be given topically. Now, these drugs, they inhibit the carbonic anhydrase enzyme and hence decrease the formation of bicarbonate in the ciliary epithelium, which decreases the formation of the aqueous humor, and this results in the lowering of the intraocular pressure and hence relieving from glaucoma. Now, the fifth class of drugs used in glaucoma is myotics. Now, the myotic used is pilocarpine. Now, pilocarpine, it is used topically because it facilitates the drainage of aqueous humor and reduces intraocular pressure. Now, the sixth group of drugs used in glaucoma is alpha-adrenergic agonist. Now, there are two drugs, apraclonidine and dipivefrin. Okay, two drugs, apraclonidine and dipivefrin. Now, apraclonidine, it acts on the alpha 2 receptors on the ciliary epithelium and reduces the aqueous humor production and thus decreases intraocular pressure. Dipivefrin, it is a prodrug of adrenaline. So this drug, it penetrates the cornea and it gets converted to adrenaline. Now, adrenaline, it increases the uveosclear outflow and trabecular outflow and decreases the aqueous humor production, which results in the decreased intraocular pressure. So these are the drugs used for glaucoma. So remember, we have the code glaucoma, B for beta-adrenergic blockers, L for latanoprost, which are prostaglandin analogs, O for osmotic agents, C for carbonic anhydrase inhibitors, M for myotics, and A for alpha-adrenergic agonist. So these are the drugs used for glaucoma.